Alright guys, this is the hip hinge assessment. Use this on any athlete that's struggling with the toe touch or deadlift mobility, pulling from the ground and keeping a nice neutral spine. They can't touch their toes. They can't pull from the ground without compromising their back. This is the assessment you'll run them through. So you're looking at a few different movements. We're going to look at the active straight leg raise versus a passive straight leg raise versus a passive straight leg raise with a little bit of added neural tension. So you'll have your athlete laying on the back. First thing you'll do is have them do an active straight leg raise. Use a PVC pipe. Mark how far they make it with their foot with the PVC. At that point, you'll come back, test the passive straight leg raise, so have them relax. You lift the leg for them. You want to see if there was a difference between their active straight leg raise versus their passive straight leg raise. If their active straight leg raise was normal, within close to 90 degrees, that athlete has purely a motor patterning problem. If the active straight leg raise is limited, but the passive straight leg raise is normal, close to 90 degrees, that athlete is dealing with a stability issue. If the active straight leg raise and the passive straight leg raise are equally limited, they're both less than that 85-90 degrees, and they're pretty close to the same range of motion, that athlete has a true posterior chain stiffness. Whether that's hamstring or neural tension, we'll find out later. But if they're equally limited in the active and passive straight leg raise, then you'll do a passive straight leg raise with the ankle forced into dorsiflex position. So you'll hold their ankle dorsiflex, do a passive straight leg raise with them, and mark whether that ankle dorsiflex passive straight leg raise was significantly less than the foot in neutral passive straight leg raise. If the ankle dorsiflex passive straight leg raise and the normal passive straight leg raise are equal and limited, that athlete's probably dealing with more of a hamstring stiffness problem. If the ankle dorsiflexed, they have a much lower range of motion than a normal passive straight leg raise with the ankle neutral, that athlete's dealing with more of a neural tension problem. So you want to note which of those outcomes you see in your athlete, and from there, that will guide what corrective we're utilizing with that athlete.